Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, happy Friday and welcome to our show, Your Hometown Medical Minute. I'm your host, Hal Brock. With me, as always, behind our cameras, our IT director, Mr. Ed Harrison.
Hey Hal, how you doing today?
And guys, we've got a great show lined up for everybody today. We are actually going to be talking to our women's health nurse, Shannon Williamson. Shannon's been alongside Dr. Nancy Deaver in our gynecology and women's health department for the last few years. And of course, Dr. Deaver has been serving Grady County here from Southern Plains Medical Center for 40 years. And so some remarkable work. And I was actually talking to Dr. Deaver the other day, and she has birthed more than half of adults that live in Chickasha today, and probably their children, maybe even their parents. So really cool, great history. Shannon does a wonderful job, and of course, Dr. Deaver does primary care, kind of women's health and gynecology for our women's population. Of course, at 51% of Grady County's population, so it's very important. Dr. Deaver is the only full-time gynecologist and women's health physician in Chickasha and Grady County, really, I think in Caddo County as well. So just a great service to have here at Southern Plains. And so Shannon's here today. She's going to talk about quite a lot regarding women's health. Of course, September, Ed, is a couple awareness month for women's health. Ovarian Cancer Awareness Month, as well as Sexual Health Awareness Month. Both are very important and very prevalent here in our market. And actually, the CDC has reached out to Southern Plains and had asked us to send out a message regarding sexually transmitted diseases. And so we're going to be talking about that a little bit today, then as well as what all Shannon does here at Southern Plains Medical Center. So a great show. Real quick before we leave, don't forget to come out to Memorial Stadium tonight here in Chickasha and root on your Chickasha Fighting Chicks as they look to go 2-0 for the second straight season. And if you can't make it to the game, or if you just kind of wanted to take us along with you, you can listen to myself alongside play-by-play announcer Howie Jackson on 106.1 The Ranch or 1061theranch.com. Let's go ahead and bring out our special guest today, the incredible women's health nurse, Shannon Williamson. All right, hey, thanks so much. We'd like to welcome our guest, Shannon Williamson. Shannon, thanks so much for taking your time.
Thanks for having me.
No, absolutely. So Shannon here works with our women's health provider, gynecologist, Dr. Nancy Deaver. You've been with her for a couple of years now, and you guys are such a great team. I mean, you do such a wonderful job welcoming all of our patients. I just first kind of wanted to know, what got you into healthcare?
It's just a passion I've had since I was little.
Okay.
I started with the ambulance service.
Really?
Went to EMT school.
I didn't know that.
Yes. Did
Cool.
that for 5 years. Continued my education there.
Okay.
Then went to nursing school. Decided I didn't want to stop there. So
Really? Okay, cool.
LPN school
Yeah.
because I wanted to be a flight nurse.
Really?
Yeah.
How
And so,
cool.
I went from LPN school to currently going to RN, and here I am.
All right. And so flight nurse, that's pretty cool. I've known a couple. What an intense line of work, of course, being EMT trained.
Right.
That's something that is that something that you kind of lean to? You kind of want to be a part of?
Yeah, I got really kind of burnt out on the emergency medical
Okay.
side for a while. My kids were young, and so it was hard. But I started working kind of clinical with the hospital, OU Medical Center.
Really?
Yes, and was there for 4 years.
Okay.
And that kind of led me here.
Down this path, down
Yeah.
to like the clinic side of
Yes.
the world. Okay, cool.
So I wanted to kind of have my experience everywhere.
Yeah, different modes of patient care. I mean, there's
Right.
different elements in each, and
Right.
you know,
Right.
something nice about clinic, you really get to establish those relationships with your patients, and you get to see
Right.
them multiple times, especially with women's health. It's kind
Right.
of, you find your doctor, you want to stay with your doctor. And Dr. Deaver has been here, 30, 40 years, and is just, wow.
Yeah.
And I mean, is state recognized and really country renowned. I mean, gynecologist, OB-GYN, practice obstetrics here in Grady County for years, probably birthed half of our population.
Right, and their kids.
Yeah, absolutely. So what all do you guys do in gynecology and women's health?
We do everything from breast exams to pap smears, even further if they need imaging.
Okay, right.
You know, pelvic imaging or lab work to determine, you know, cancer, hereditary gene.
Yeah.
We do a lot. Dr. Deaver still does some procedures in clinic.
Okay.
That, you know, precancerous procedures.
Okay, and you hit on something, well, a couple of things really neat that kind of separates our clinic, which I love being here at Southern Plains. You mentioned radiology and imaging. You know, we have some wonderful capabilities here. Katie Arbuckle's our radiology director. We have an open MRI machine, way more comfortable than a closed tube. We have ultrasound capabilities, which go hand in hand with you guys, and wonderful instrument, the latest in digital x-ray. And then we also have a bone density machine. So you definitely have a lot of options. And then you mentioned the lab testing for cancer. And September is actually Ovarian Cancer Awareness Month.
Right.
It's very prevalent.
Yes, very. And it's very extreme, like the progression of it.
Really?
Yes. Okay. Most women aren't even diagnosed until the later stages of ovarian cancer.
It's what you don't know and what you don't find out.
Right.
That should be the fear.
And it's a silent killer, ovarian cancer is.
Really?
Yes.
What are kind of some of the symptoms that people should be on the lookout?
Number one with ovarian cancer is hereditary.
Okay.
If it runs in your family anywhere along the line, grandma, great-grandma, aunts, any of that, you're automatically, you need to be having a screen.
Okay.
There's a blood test that's used to detect by the numbers of the elevated numbers of that blood test, as well as an ultrasound. Pelvic ultrasound is the best way, really, to diagnose.
And that's all stuff that you can do, right, that you guys do
Yes.
for patients. That's amazing. What are some of the ways that preventative measures that we can take in incorporating you guys?
Well, unfortunately, with ovarian cancer, unless you are just proactive with trying to figure it out and really watching for it, a lot of times the side effects of that are unknown for so long, because a normal pap smear does not detect ovarian cancer.
Oh, really?
No, it doesn't.
Oh, wow.
Yeah.
So then it's just once those symptoms kind of occur, it's symptomatic, and then that's kind of where you're like, well, it's not normal, we're not picking it up here. Then what's the step? How do you kind of pick it up? You mentioned lab, or you mentioned imaging, the elevated labs?
Yes.
Okay, cool.
A lot of times with our patients, particularly, if they have a history of it, or, you know, in a family history, they know kind of what to watch for.
Okay,
But people who don't know or don't have a history that they can go back and check. It's just one of those things that by the time they are experiencing outside symptoms, you know, we're at that latter stage of, you know, we need to find it.
Right.
And Dr. Deaver's really good about knowing when to order those tests. I don't know if it's just the sense she has, but she can call it almost every time.
Well, just a brilliant doctor, and I mean,
She's good.
Yeah, it's amazing to talk to her, and you know, she's seen it, and she's diagnosed it. Like we said, I mean, 42 years in this market. I mean, rural health, anywhere you're gonna see the full gambit.
She's really big with the myriad people that do the genetic testing as well.
Okay.
And so she's a big advocate for that. We actually screen just about every one of our new patients in with the questionnaire to see if they even qualify for that testing. And if they do, Dr. Deaver's immediately on it.
Oh, for sure.
And if they come back with that gene or any gene that we're testing for, they immediately start the preventative medicine.
Wow.
So it changes the scope of the practice with that patient particularly.
Absolutely. The whole course of the health outcome, I mean, changes. I mean, and that's
They're not
amazing.
like the normal yearly or tests are ran on them automatically that wouldn't be ran on someone else.
Absolutely.
So.
Well, what a cool, luxury afforded. I mean, a fully COLA certified laboratory right here at Southern Plains. So, patients can really do everything here, that involves women's health.
Right.
Okay. Now, another thing that I wanted to talk about. So September is a very active month for the National Health Organization. They have a lot of awareness. Kids are going back to school. People are really in work. The vacations are over. So I think it's just their time to really reach out to a lot of people because they kind of know where people are. September is also Sexual Health Awareness Month. And we're in healthcare, and so this is definitely something that we need to talk about. In fact, you had actually mentioned that you got a letter from the CDC and that our area, Grady County, was kind of having an outbreak in sexually transmitted diseases.
Yes.
Can you kind of expand on that a little bit?
It started small and then just progressed rapidly.
Really?
Yes. Age range everywhere from 16 to 62 that we've seen, and it just progressed. There's many STDs out right now that are active in our county.
Okay.
And so basically our goal here is to not only get them in and get them treated, but follow up to make sure the treatment is working.
Okay.
Passing out safety measures and educating. Educating is a big thing.
For sure. And I think, that's definitely something that we want to do. And in fact, the CDC asked us to kind of talk about it. And so I wanted you to have kind of this platform to maybe reach out to some people that we don't see. Can you go over just some of the basics of proper sexual health and, some of the things that are out in our county that people need to be on a lookout for, and the symptoms?
Currently, we are faced with gonorrhea, chlamydia, syphilis, and trick is our main concerns right now in our county. We're starting to see herpes more than what we were in the beginning of this, but it's starting to now ramp up as well.
Wow.
The best way is abstinence, of course. Don't have sexual encounters with people you're not familiar with their history. Condoms all the time.
Right.
And just, if you get treated, you have to not continue with sexual practices until the treatment is over. And that's a lot that we're seeing as well.
Okay.
We're treating them, they're thinking, I don't got to wait.
Because they got the treatment?
Yeah, I don't have to wait 7 days. Yes, you do.
Okay.
we're spreading fast.
Wow. Okay. Now, everybody takes health. We start that young. I mean, sixth grade, I think, we first had introduced to it, and then on, you kind of continually have it. But I am like most people in healthcare. I'm fairly ignorant, right? That's why you guys do what you do, and that's why we come and see you guys. There's a couple things that I wanted to touch on. First, I didn't really understand what trick was, so if you could go into that and explain that to me. I've never really heard that terminology before. And then second, to my knowledge, all of those are curable, treatable, except for herpes. Now, that's not curable yet, it's still, but episodically treatable or manageable?
Manageable.
Okay.
Symptomatic. It can be, you're managing your symptoms basically.
Okay.
But it never fully goes away. And you are contagious throughout.
Okay. All right. So definitely the measures that you're talking about, protective sex and or abstinence. For somebody, that has herpes, you just need to take the measures. There are prescriptions.
Yes.
I guess that manage.
Medications that help the patient's symptoms.
Okay.
That's about all that it would do.
Right.
It doesn't stop anybody else from catching it, but it helps manage the symptoms the patient is experiencing.
Okay. But, it's important also for people to have these conversations with people that they meet, right?
Yes. It is not, it's more embarrassing to come to the doctor for treatment than it is to just ask the question. And talking to the people that we've talked to that we've treated, that's the first thing they say. Oh my goodness, I should have just,
had that talk and or, furthered that relationship so you get to know the person.
Everyone's, you asked me about symptoms, and everyone's symptoms are basically the same. If it's abnormal and it hasn't always went on, go get it checked.
Okay, right.
And the CDC is basically having us check everything that's a little awkward.
Okay.
Where typically before we can just go, oh, it's this, and give, a treatment, we are swabbing everyone.
Wow, yeah.
Blood tests are also being ran for the bloodborne carried diseases as well as all the swabs. for the females and the males.
Now, are all the treatments, prescription that they can pick up and take at home?
Yes.
Okay.
Except for gonorrhea and syphilis. They are treated in the clinic with injections. But gonorrhea is a one-time thing. Syphilis is a two-time thing. So come back 2 different occasions, but it's treatable.
But it's treatable.
Yeah.
Okay. Now, are they all kind of, you mentioned like a 7-day window?
Yes.
You get a prescription, it's all kind of, a week, and you're going to be okay?
Yeah. Other than syphilis, we suggest on syphilis a week after your first injection before you can have intercourse. And intercourse at that point is only with protection.
For sure.
For 30 days before you come in again and be retested.
Okay, that's good to know.
Because a lot of times that and chlamydia are not, for whatever reason, sometimes cured the first treatment. Sometimes the resistance, the strain of it may be resistant to the medication, and we have to switch it up.
Wow, okay. Man, if you're young, active, our world's a lot closer, with technology and everything, it's going to happen. We just want people to be educated, be smart about it. And then if things are abnormal, come and see you guys.
Absolutely.
First symptom.
Absolutely, first symptom. Yes.
Now, because sexual health, and I'm not a doctor, not a genius, so I'm glad I have you here. You're the expert. But something with that, that can spread into like viruses. It can make you physically ill other than just through your sexual organs, right?
Right, yes. Many of them can lead to very serious issues elsewhere in your body.
Okay.
Yeah.
All right. Okay, and so the CDC also, along with the recommendation to kind of educate and kind of put out some information, they're also sending materials, right? Brochures.
Pamphlets on every STD that is going around our county.
Okay.
So they're good little flyers. They're actually very educational little tools to use, and condoms.
Okay, really? So
yes, they are. We're getting thousands a week, and I've been distributing them throughout the clinic.
Okay, all
right.
right.
All the other providers.
Good. Thank you for that. Okay.
Welcome.
Well, perfect. You're so awesome. So it's very nice to have you as a resource here so that people can learn from you and kind of educate them. So I want to continue to have you back if you would, so we can have these conversations. October is going to be a big month too, and everybody, I call the Chickasha Fighting Chicks games, and so we always do a breast cancer awareness week and game, and so it's in October, right?
Yes, the month of October is Breast Cancer Awareness Month.
Okay, and so you guys do women's health, so that's something that you guys can assist with, and then of course the OU Mobile Breast Network comes down, but then we have other partners and resources that help as well, right?
Absolutely, mammograms yearly.
Okay.
We also, that genetic testing, that's mainly what we test for.
Okay.
Because we have a lot of patients with family members that are.
Or does it actually tell patients that this is something you're going to have?
Yeah, basically, there's different tests. There's ones that show that you have the gene.
Wow.
There's some that show you're not a gene, but your children could have the gene because you might not be carrying it. There's also your probability rating based off the blood test, a percentage before age 50, after age 50, what your percentage of getting it is. And then we just begin the preventative side of that based off those results.
Wow. Man, science is pretty cool.
It is really, and it's been able, with our patients, we've been able to really detect a bunch and cut back a lot. We've had women have mastectomies that have never had a diagnosis, but because of their probability being so large, don't want to take that risk. And that's it. Every patient's options and choices on their own. So, it's just whatever fits in their style.
Well, personal health, you only get, that's the most important thing that we have in this world.
One chance.
Yeah, absolutely. Shannon, thank you so much. I'm gonna ask you to come back in October so we can expand.
Okay, perfect.
Awesome. If you guys want to see our wonderful women's health team, Shannon Williamson and Dr. Deaver, give us a call, 405-224-8111, and they can definitely get you set up. Or go to our website, www.spmcmed.com, and you can schedule your own appointment. Really cool. Thanks so much, guys, and we look forward to talking to you later.